HIPAA. Oh, hi. Just doing a little bit of light reading here. My name is Nicole Velasquez, and this presentation will cover PHRs. In this overview, we will go over what personal health records are also known as PHRs. Through interviews, we'll get an idea of how patients use real PHRs. We can also see how familiar people are with personal health records. Next, we will learn about the different types of PHRs and where they are seen. After, we will listen to real patients about what changes they would like to see in healthcare to improve their overall experience. Then we will talk about the future of PHRs and how we can take what we have learned to change the future of healthcare. Lastly, we will end this presentation with a summary. So let's see what patients think PHRs are. So I'm here today with
Joe Velasquez.
Nice to meet you, Joe. Okay. So I wanted to ask you, do you know what a PHR is? It's a personal health record.
Yes, I have one through Kaiser.
Do you know what goes into a personal health record?
Recommendations, your weight, your diet, things that make you healthier.
I'm here with
Julio again.
Julio. Do you know what a PHR is?
I do, yes. It's a folder that has past visits, history, all your information about you as the patient. So therefore, it's just passed from doctor to doctor so they can streamline how they know you.
Okay, cool. Thank you. Okay, so I'm here with my mom. Hi. So, Mom, do you know what a PHR or a personal health record is?
No.
No, okay. What do you think goes in your own personal health record?
Name.
That's a good one.
Hi, I'm Embryo.
And how old are you, Embryo?
I'm 10 years old.
So, do you know what a PHR is?
Of course I do. It is an electronic lifelong resource of health information needed by individuals to make health decisions. Individuals own and manage the information of PHR, which comes from the healthcare providers and the individual.
Wow, spot on. That sounds a lot like the HEMA definition.
Thank you. Do you still need this?
Get out of here. So, Dad, do you know what a PHR is or a personal health record?
No.
It's okay. It's okay. What do you think goes into someone's personal health record?
History?
Okay.
Yeah. History, yeah.
Okay. What else do you think goes in there?
Anything from your health? Personal health? Let me see.
Are you Googling PHR? Yeah.
Yeah, I never heard
so,
PHR. Personal health records, PHR is an electronic application through which patients can, I don't know anything about it. What it says it is. Personal health record.
There we go. My sister, Helena. So do you know what a personal health record is?
Is it now?
If you don't know what it is,
You spent like 3 minutes talking about
you
it.
should be well informed now.
Sure.
Okay.
Now, PHRs or personal health records typically have patient demographics that usually consists of date of birth, address, or even religious affiliation. You may even see medical history or a medications list, current medications, past medications, or even new prescriptions. Allergies to those medications may also be listed, or general allergies. Lab tests may be also in there, either past lab tests or upcoming results for lab tests that were already performed. You may also see your age and even weight. Now that we have learned what goes into a PHR, we can now discuss some usage of PHRs. For example, it could give patients more autonomy, control over their information, for example, whether or not they want to give or share that information, or to which organizations they would like to share that information with. It can also be used for end-of-life care decisions or through coordination between multiple providers if they have providers in more than one state. It can also help with better documentation or, for example, for safety when it comes to prescriptions. We want to make sure there are no contradictions between any medications that were already prescribed.
Now, according to the Health Information Management textbook, personal health records, an electronic or paper health record maintained and updated by an individual for himself or herself, a tool that individuals can use to collect, track, and share past and current information about their health or the health of someone in their care. So now that we know what PHRs are and what we can use them for, let's get an idea from the patient's perspective as to how healthcare can be easier for them. So let's get right to it. Would you say would make healthcare easier for you to use? Like, how would it be easier for you to utilize if something was changed?
I don't know. Right now, I have easy access to my healthcare provider through the internet because we have COVID-19 restrictions, and I do have phone appointments with doctor. In fact, I had one recently 2 days ago.
Oh,
So we
okay.
keep up to date, keeps me up to date on my lab tests, medications, and all that.
You're a veteran as well. Do you
Yes.
experience any delays in healthcare as a veteran or any issues in that area?
None at all. What I do experience delays is since Obamacare was into effect now, Kaiser, where I go to get treatment, is swamped with people.
Thank you for taking the time and talking with me.
You're welcome, Nicole.
As a patient, how could healthcare be more beneficial to you? Is there a change that you'd like to see in healthcare to make it more available to you or easier to use?
Communication, so going maybe online so I don't have to call someone
Mm-hmm.
to make it easily accessible.
Okay, so like a platform that you can utilize so that you don't have to speak to someone. You can kind of
Yeah.
like ordering a pizza.
Yeah, make it easier so I don't have to wait. I can do it whenever I want to.
As a patient, how could healthcare be easier for you to use or more accessible for you? Could change something. How could healthcare be more accessible for you?
Get the information online. Don't we get it already online?
Okay.
Yeah.
So if it was available online,
Yeah,
you think
and on your phone.
on your phone?
Yeah.
Okay. Anything else?
Pretty much anything online. Yeah.
Online,
On your
yeah.
phone, a message, update.
Thanks, Dad, for
Okay.
being thumbs up. Is there anything you'd like to say to the audience?
More update.
Get more
On your
updates for your phone.
The PHRs.
And the PHR. Thanks, Dad. You're awesome.
Okay.
Thanks. Bye. As a patient, aren't you a veteran?
I am, yes.
Thank you for your service. How, as a veteran and patient, could healthcare be more beneficial or useful to you? What would you like to see if you could make a change?
Appointments take long to book, about a month to 2 months.
It's a long time.
Yeah, so if you want to see your doctor, you're gonna have to wait a while.
Timely visits, right?
Yes, and or more prompt communication between the doctor and patient. The problem is when the information gets lost between patient and either nurse or nurse practitioner to the
Okay.
doctor.
I can see that it can be a problem. Thank you for taking the time being here to meet with me today. Okay, you can get back to your football.
Okay.
How can healthcare be more accessible to you?
I don't know.
You're full of information, Helena. Thank you. Awesome.
You're the one that does it for.
Now let's talk about the different types of PHRs. There are standalone and tethered PHRs. Standalone PHRs typically consist of patients filling in their information, but that information is stored on patients' computers. The patients also have control of whether or not to share that information or how it is shared. Tethered PHRs are linked to a healthcare organization. Patients have access through a patient portal. They can view the data but not alter it. It is also protected under HIPAA. With MedMesh Health, the Dutch government wants to make sure patients are taking part in their healthcare. They are focusing on bringing all parties together, which is where the PHR comes in. By doing this, they are creating these fertile grounds for an ecosystem to work or flourish. The next step is to work on interoperability. By creating a council that gathered hospitals, long-term care organizations, medical specialists, general practitioners, and even patients to agree on standards, such as whether or not to use HL7, FHIR, or IHE. They want it to be impossible to conduct business in the long run without these systems talking to each other.
MedMuge is trying to create a market for personal health environments. They've set a 3-year plan to create these environments that include apps that connect from the mobile devices to hospitals, pharmacies, GP systems to allow the patients to have full oversight over the data and the ability to choose who gets what information. Working with the Ministry of the Interior, they have an approved authentication system in place. However, it doesn't currently meet the level of security that's needed. They found that the higher the security, the less user-friendly it is.
The future of PHRs can be affected from what we have learned. Age, racial ethnicity, internet access were all predictors for personal health record adoption. Participants 65 and older were less likely to see the importance of it. Hispanics were more interested than non-Hispanics in their health record. Participants also had difficulty understanding provider notes and results. They preferred simpler words and medical terms. Rules and security for PHR are still new and emerging. However, they're an area of concern, with about 48.3% saying they take this issue seriously. Identity theft and limitation of employment due to chronic conditions were top concerns.
Now, the FDA reported more than 30,000 medication errors with not one single entity to put the blame on. Patients are able to fill prescriptions at different pharmacies. Now, without being able to keep track of prescriptions, patients are at risk of medication errors. Now, pharmacies lack interoperability with other pharmacies. Patients may also have more than one provider if they live in different states or countries. For example, if parents share custody of one child, that splits the time between 2 different states or countries. Chronic conditions or diseases can be difficult to coordinate or treat without interoperability. However, PHRs can be the bridge between providers and even pharmacies. Who would have thought?
In summary, through research, data has shown patients want a web-based platform to access their records. Physicians have been wary of PHRs due to more administrative work and untrustworthy documentation. We have the ability to use technology today to make ways to sort through important information by using NLP, or natural language processing, which picks up on keywords or phrases. The IOM, or Institute of Medicine, called for the adoption of PHRs back in 1999, with expectancy of the U.S. to meet Stage 3 of meaningful use by the year 2020, without any incentives. They expected the products that were available back in 2014 to meet and exceed expectations. PHRs can still help and meet the triple aim of reducing cost, improving health outcomes for populations, and improving the experience of care for patients. We can manage chronic diseases, which accounts for over $3 trillion of the U.S. healthcare spending annually, while involving patients in their care with the use of PHRs.
In conclusion, we have learned how important personal health records are, or PHRs, and how they could be the missing link between healthcare organizations and even pharmacies to create that interoperability that we strive for. Don't forget to hit that like button and that bell to get notified when new posts about helpful information coming to you. And don't forget to subscribe. Got to get back to my light reading here. R-E-H-I-A. Past that, don't need that anymore. bloopers going. Beep beep.
Hey, sir. Do you know what a PHR is?
Bond, James Bond. Spying is the game.
This is for educational purposes. Yes.
Me or who?
This interview.
Yes, I do.
What is that?
It's
Mom, the beeping on the microwave.
They need to speak dog.
Why am I being interviewed about something I don't know? I don't know. I need to know.
You go to the doctor,
Yeah, but it never tell me your PHR.
health, so
No.
that's your own person.
Really?
Well, I mean, it's clearly
Oh,
not.
that's a new thing?
No, it's not new. It's been around for a while.
I don't have a. Do you have a PHR? I don't.
Don't forget to hit that bell or that bell. Hit one of the bells.
Zora, what's a PHR? Shake. Shake. What are you doing? Okay, that's not gonna work. She just wants to sit.